Today by Dr. Renee Edwards, Chief Medical Officer of OHSU Health, Dr. Peter Graven, Lead Data Scientist in OHSU's Business Intelligence Unit, Dr. Don Nolt, Professor of Pediatrics and Infectious Diseases at OHSU Doernbecher Children's Hospital and OHSU, and Dr. Abby Tibbs, Vice President of Public Affairs and Marketing. They all have doctoral degrees, so they all get called doctor. They will discuss the latest COVID-19 forecast data and the drastic impacts on hospitals and health systems statewide. Following their presentations, we will take some questions. If you'd like to ask a question, please put your name and the media outlet you represent in the chat box, and I'll call on you after. Please remain muted until your name is called. I'll now ask Dr. Renee Edwards to start us off. Thanks very much.
Thank you, Tamara, and good afternoon, everyone. As Tamara said, I'm Renee Edwards, and I serve as the Chief Medical Officer at OHSU Health. I'm here once again to ask all Oregonians for their help in stopping the spread of the coronavirus. We haven't used this term in a little while, but we once again need to do something that Oregon has done so well in the past, which is flatten the upward curve that the COVID-19 virus is taking in our state. The situation across the state is frankly dire, and as you will soon see, is projected to become significantly worse. OHSU and other hospitals across the state are at their fullest capacities, and some, especially in Southern and Eastern Oregon, are beyond the tipping point. We are seeing a drastic increase in patients hospitalized due to COVID-19. Many of these patients are younger and sicker than previous surges that we've witnessed. The Delta variant is significantly more transmissible and appears to cause more severe illness than the original COVID virus. Oregon's hospitals and clinics are also experiencing a high volume of seriously ill patients who don't have COVID, including those who have delayed care during the past year due to the pandemic, patients with the critical conditions that are always present in our hospitals, such as heart attacks and strokes, and trauma patients who sustained critical injuries due to accidents. As of Monday, there are 575 COVID-19 patients in Oregon hospitals and 148 in ICUs. I'm certain that number is greater today. At OHSU, one of just 2 Level 1 trauma centers in the state, 30% of our ICU capacity is now being taken up by COVID patients, and 95% of those patients are unvaccinated. This surge of COVID-19 patients comes as we continue to also face debilitating heat waves and the threat of continued wildfires, along with a severe healthcare worker shortage. And I want to thank all of the healthcare workers at OHSU and across the state who've worked tirelessly for the last 18 months. OHSU and other Oregon hospitals are taking steps to keep beds open for the state's sickest patients, including increasing the level of statewide hospital coordination, especially for the sickest Oregonians, working with state and federal partners to determine what resources may be available to assist with this crisis, and significantly reducing inpatient surgical cases by placing a cap on the total number of cases that we do each day. However, even with these measures in place, OHSU is not able to accommodate all of the patient transfer requests that we're receiving from hospitals around the state, some of whom require surgical care. We're in crisis. Please remember that the actions we take today do not actually impact the rise of COVID infections for at least 2 weeks, or rather start flattening that curve, and the hospital census for about 3 weeks. You can help stop the spread today by staying home whenever possible if you are unvaccinated. Just like at the beginning of this pandemic in the spring of 2020, when we all stayed home and limited our non-essential interactions as much as possible to reduce spread and reduce our personal risk of infection, if you are unvaccinated, you should do this again now. And whether you're unvaccinated or vaccinated, If you leave home, please do 2 of these 3 things. Wear a mask, physically distance, and stay outdoors for your activities as much as possible. And now I'll ask Dr. Peter Graven to walk us through the details of OHSU's most recent COVID-19 forecast report. Dr. Graven.
Thank you, Dr. Edwards. As was introduced, my name is Peter Graven. I'm going to share with you the forecast that I provide every week. And this one, unfortunately, has some terrible and bad news. What I'm showing you in the red line is the hospital census statewide in Oregon. And for those of you who followed these forecasts in the past, I think this is the easiest way to understand both where we are in the pandemic and also the impact on our critical resources of the hospital. As you can see, we are in our 5th wave, and the red line is going straight up. And that is the steepest increase we've ever seen. And this is at a time with a lot of vaccinated people. What has happened is the Delta variant, when it arrived here in about the middle of June, as soon as it got going, it is 2 to 3 times faster than the original virus, and therefore, even with a lot of people vaccinated, it can spread this quickly and create this level of census capacity or hospital census in the state. As you can see, we're at a census level that is equal to what we've had at any previous wave, and the slope is going straight up still. We don't have a policy. The policies that we've done recently, frankly, haven't worked. We recommended masks, and I'll show you some data about that, but the recommendation from the CDC, state or local areas, haven't changed the mask rates enough to impact this curve. And so, as Dr. Edwards says, it's created a real catastrophe across the state in terms of hospital capacity. Here, this chart is showing you the census per capita in each region in Oregon. So they've been adjusted for the population levels. And the idea there is you can see the trend, and you can also see which regions are doing better or worse than the others. And the key point here is all the regions are on the upward slope in the most recent days. So you can see each of the lines is going up in the last few weeks. Region 5, unfortunately, Jackson and Josephine County, which include the cities of Ashland, Medford, and Grants Pass, is having just a dramatic increase to levels we've never seen before. So you're going to be hearing about that, but all areas of the state are being impacted. The key resource, of course, that we're worried about is the hospital, and within that, the ICU. And I've been producing this every week, and we're again reaching levels we've never seen before. The key stat here is the percent of occupied beds filled with COVID patients in the ICU. And what you can see is this blue line, it's going up and down, up and down, up and down. And when it goes up here at the end, it's streaking past our highest percentages we've had. Over 25%. When I look today, it's over 30%. That means over 30% of the people in our ICU now are COVID patients. Our ICU beds, of course, are normally used for many other reasons, and in order to make space for this, there's just not the beds, particularly in some of the critical hospitals where it's needed. Mask wearing. This data shows the percent of people who are indicating they're wearing a mask over the last 7 days on a regular basis. As you can see, we started at 90%, and Oregon had always had a very good mask wearing rate. But as vaccination rates increased, and as many recommendations were to take off your mask, our mask rate plummeted down to 32% as a low. Now, as things have picked up, different people have made recommendations. You see a slight bump up to about 44%. But that is nowhere near where we were before, and certainly not at the levels that have been able to impact the transmissions and then the resulting census. So where's this forecast? Where do I think it's going? The model requires some assumptions, but basically it's looking at the trend today and then combining that with how many more people do we think are going to get vaccinated, when is that efficacy going to take hold, what is the current speed based on what we know about the Delta variant, and additional impacts of policy. And right now, if we just continue on the path we are, you can see the black dots are the forecast. They continue to go up for many more weeks, and we exceed over 1,000 beds, which is, we're essentially full right now. We do not have additional beds today for COVID patients in almost all regions. And this is showing another 500 would be needed by September 7th. So that is a dramatic increase, and so we're looking at a giant wave right now that's all taking place over the next 4 weeks. As Dr. Edwards says, even actions today probably won't impact this forecast until at least 2 weeks away from now. So we're already above where we've ever been. To put into perspective, I'm going to include this, which shows some of the key policies that we've done in the state. And their impact, you can see graphically, their impact on what the curve has done. We had the stay home campaign, we had a mask mandate, we had the freeze, and we had a back to extreme period of time. In each of these cases, we had a steadily rising census, and very quickly we were able to flatten that curve, as Dr. Edwards was saying. We definitely are going to need to do that again, and we're going to need everyone to be able to, every action is going to be important. I believe we have Dr. Nolt is going to tell us a little bit more about the impact, and I'll switch it over to her.
Thank you, Dr. Graven. Good afternoon. I'm Dawn Nolt. I'm professor of pediatrics and infectious diseases at OHSU and OHSU Dornbecker Children's Hospital. The data that Dr. Graven discussed is certainly very difficult to hear, especially since Oregonians have made really such progress against COVID-19 earlier this year. But as he said, and what we know is that the dominant strain in Oregon is the Delta variant, and Delta is different. It's more contagious than the previous non-Delta variants. But the good news is that we know what needs to be done. Even though we're all tired of taking the necessary precautions to protect against the virus, we know that we can and we must continue this work in order to restore the progress that we have made initially. So I want to emphasize that getting vaccinated is the single best thing a person can do to prevent severe illness and death from COVID-19, particularly the Delta variant. If you're not yet vaccinated and you're eligible to be so, please do not delay. Please get yourself vaccinated. It does take 2 weeks after your second dose of the vaccine to be fully protected against the virus. It's not instantaneous. And we also want to know that even if the vaccine is very safe and very effective against severe COVID-19, if a vaccinated person does become infected with the Delta variant, they can be quite contagious. So to change this surge, to try to level the peaks, Oregonians, regardless of whether or not they receive the vaccine, they should wear masks and be as thoughtful as possible about the need for community interactions. And to be quite frank, if you are unvaccinated, please limit unnecessary interactions in the community and stay home. As Dr. Edwards noted previously, we are seeing younger and sicker patients than before. And particularly for our kids, we really should pay attention and try to protect them as much as possible. We know that they can become infected and they can recover, but we don't know the long-term effects of COVID-19 in children. We know that there's long haulers in adults, and we also see this in children as well. So we want to keep them protected, and many of them at this time do not have the opportunity to be vaccinated. So in addition to the measures that Dr. Edwards outlined to stop the spread of the virus, we'd like you to think about 3 things and to try to practice 2 of the 3 things in the upcoming weeks. We'd like you to wear a mask, physically distance, and stay outdoors as much as possible. We ask Oregonians to consider the safety of other activities as well to limit the possibility of your need to come to the hospital for other reasons. And so our hospitals are already overflowing and we need your help. So keep yourself safe and healthy. We recognize this is very hard, but every mask, every vaccine, and every attempt to limit gatherings is important at this time. And Oregonians have done it before, and we can do it again. This time we have all the tools we need to prevent the spread of COVID-19 and the surge of Delta we're seeing now. We can vaccinate, we can mask, and we can physically distance, and let's use all of them to keep our families and our communities safe. Thank you.
Thanks all. I see we have a question from Ted Sickinger first in the chat. Go ahead, Ted.
Yeah, thank you. I just got off a presser with St. Charles out in Bend, and they were talking about I'm wondering why hospitalizations are so high. Is it because folks are sicker and staying longer? Are you, like St. Charles, having difficulty discharging patients to skilled nursing facilities when they are well enough to be moved? And can you also, Peter, just tell us what the exact day of that peak that you're forecasting is? I'm sorry, those are two unrelated questions, but there you go.
Peter, you want to answer that question real quick first, and then I can take the other ones.
Sure. Yeah. Ted, the peak there is September 7th, approximately 1 month away.
Thanks for your question. Many of the things that you heard from St. Charles are exactly what OHSU and most of the other hospitals in Oregon are experiencing. We are seeing sicker patients. We know that there are a fair number of people who deferred both preventive healthcare needs, but also, some low-grade ongoing health concerns during the course of the pandemic because they were concerned about accessing healthcare early on in the pandemic. And therefore, many people are presenting with their diseases or their chronic illnesses a little further along in progression than they might typically have been seen at a hospital or by their primary care provider prior to the pandemic. So people are presenting sicker. And, normally healthcare comes along in its normal standard amount of kind of patients per day or volume per time. And that slowed down a little bit during the early days of the pandemic. So there is a need to catch up to the care that was deferred. And for some people who deferred that care, they became more ill during that time. So yes, patients are presenting sicker. So even before this surge started, many of our hospitals were already pressed to significant capacity constraints, just taking care of the many conditions other than COVID that we need to provide for Oregonians. Oregon also tends to be a state that does a pretty good job of maintaining our health and wellness, and we actually have fewer hospital beds per capita than most other states, and so we don't have as much of a cushion for managing our hospital capacity. And relative to your other question about throughput, which is where our patients go after discharge, you'll be aware that some people have the opportunity to be discharged to their home, but a fair number of patients also require discharge to what we call post-acute areas of care, whether that's nursing homes or long-term care facilities, some type of home health arrangement. And it is harder and harder to place patients into those locations because they're also experiencing staffing challenges, just like our hospitals are, and having to manage the control of COVID within their sites of care and maintaining careful regulatory and infection prevention regulations. So the whole throughput has slowed down during the pandemic.
Thanks very much, Dr. Edwards. Next question is from Gary Warner with East Oregon Media. Go ahead.
Yeah, hi, thank you. There was an interesting item that was in the report on the 20th that Oregon is the, I think, 5th or 6th most susceptible to infection in the whole United States, this immunity index, basically, because we had a good suppression of the virus and yet don't have a lot of people, as many people as we want, going to get the vaccine. Can you talk a little bit about that and what special problems that presents for the state?
Yeah, I can answer that. The immunity index, which is a metric I put together, essentially combines your vaccination rate with the number of people that we think have been previously infected. We know they don't have exactly the same amount of immunity, but roughly similar. And so we're adding up that group of people to try to figure out how many are still susceptible. And in Oregon, we have above average, slightly above average vaccination rates, but our previous infection rate, because we've been successful, is much lower than almost any other state, really. And so it's almost counterintuitive, but that causes us that creates additional risk for the surge we're seeing right now. And indeed, that I think that index did show that we had the potential for this, and so we should also believe that it's going to go away very easily because we have this large percentage of people who are still susceptible. There are other states that you may have seen on that list who had much higher vaccination rates. Vermont's a good example, who had low case rates but high vaccine rates, and their performance right now is they're experiencing a much more mild surge, and I would expect that to be the case for them. Does that answer your question?
It does. One other follow-up on the same thing, though. You talked about September 7th as the peak for hospitalizations. Do you have that information for infections? And can you also talk about the backside? If we're talking about September 7th, some of the projections I'm seeing from IHME and other groups are saying November, December for this thing to flatten out.
Yeah, I think all modeling requires assumptions, and so in that case, identifying the peak date is pretty tricky. In this case, what we're looking at is how fast the virus spreads, and we're mostly interested in essentially what you're looking at is a wave that takes us all the way to herd immunity, but it does it in kind of the worst possible way. So we're essentially showing if you infect everyone in a very short period of time, and all those people end up coming to the hospital. That's basically what we're seeing. And so different models are going to vary in exactly how that plays out. In some models, it'll assume you'll take certain types of actions, and so it could be spread out over more. In fact, that's what I think we would hope to happen, is that we push that surge out over a longer period of time with various behavior change by the population and policies if needed.
Thanks to you both. Next question is from Kelly with KATU TV.
Hello, thank you for taking my question. My questions are for Dr. Nolt specifically. Talking about children getting COVID, can you talk to us a little bit about the numbers that you're seeing? There are a number of hospitals nationwide that are saying they're seeing spikes in young children getting the coronavirus. And then after you answer that, I just have one follow-up for Dr. Nolt as well.
Sure. Thank you so much, Kelly, for your question. So right now at OHSU, we have less than a handful of children who are hospitalized and have COVID-19. They may be hospitalized for other reasons, but happen to have COVID-19 incidentally. So we are not seeing what you have seen at other parts of the country. We do think that, when children become infected, they may not have as symptomatic of disease and not get as ill and could recover quickly. But it's really a numbers game, because the more the Delta variant gets out there, the more contagious it is, and it will spread to more kids. You'll have a rise in the number of kids, and therefore, even though the percentage stays the same of those who could become infected and become ill enough to be in the hospital, that sheer number will go up. So what I'm worried about in Oregon is that if this Delta variant continues to spread, it will get into our pediatric population and more numbers will be sick, which will result in more numbers being hospitalized. But we're not seeing that right now.
Thank you. And then my last quick follow-up for you is about the vaccine. There's been, as of this morning, a push for younger kids under the age of 12 to be green lighted to get the vaccine. What's your take on that, and how should parents be feeling about that thought?
Sure. So right now, the FDA and the CDC's advisory committee, the ACIP, really want to make sure that vaccination and vaccine safety is at the forefront of any efforts to vaccinate any age band, including kids under 12 years of age. So we would really like to have as much of the population vaccinated as possible. And I'm a pediatric infectious disease doctor, so I feel very strongly about vaccinations. We want to do it safely. And as you get younger, into younger and younger age bands, we just want to make sure that we have the right dosing, we have the right schedule. And so we want to make sure we have all that data at this time before we proceed. We want to follow the science, Kelly, and right now we are looking to the FDA and the CDC to review that data and then finally let us know what their recommendations are.
Thank you.
Thank you, Dr. Knoll. Next question is from Erin with OPV.
Hi, my question is for Dr. Gravens. Knowing that, if we were to take any actions today, they would take a few weeks to be seen in the transmission data or to be seen in the hospital data, where would that put us under your model? Like if we today started a mask mandate effective today or implemented social distancing measures, where would that leave us in 2.5 weeks? What will our curve look like in that time?
Thanks, Erin. Yeah, so this model does not include the effect of something like that. And I do think it, like I've kind of showed in the slide, when we've done actions like that before, it has blunted the wave. So I would expect it to have an impact. Now, how big of an impact, and making sure, our highest risk folks are adhering to whatever policies and whatever preventive measures is the key part there. But if we get that, we can definitely save, I would say, we're seeing an increase of 500 beds that are going to be needed. My guess is we could cut that by 200 if we took action quickly. And remembering we basically don't have those beds. So I think being able to cut that in half or close is kind of the goal here by taking swift action.
I think I might have framed my question incorrectly. I think more what I'm asking is how much of that surge that the model is predicting is baked in. So you said that it might peak in August, but looking at or that it would peak in early September, but looking at just 2 or so weeks from now, where will we be?
Well, so in about 2 weeks, we'll be about halfway to the peak. And so we're at, almost 600 beds now. We're we're aiming for almost 1,100. And, so we'd be about halfway there. It's about 4 weeks away. So we're kind of on that path. I might maybe not totally understanding your question, but if we take action now and presumably we can get up to around 800 beds, hopefully we can stay under that, or maybe 900 in total.
That answers my question. Thank you.
Okay.
Thanks, Dr. Graven. And I'm gonna let Pat ask the last question. Sorry, Destiny. Go ahead, Pat.
Okay, thanks. Dr. Graven, I just wanted to clarify, I think I saw on one of the slides, the replication rate for the current Delta, I believe, is that 1 to 8? So each person is infecting 8 others? Is that correct, or did I read that wrong?
That's right. And that is exactly the dramatic change that happened in the virus. The original virus was infecting 3 additional people, and now it's infecting 8. And, quite frankly, we had the immunity level that would have been probably good enough for the original virus. So when we were shooting for a 70% vaccination rate and, given what we had, we were probably in okay shape there. But all of a sudden the Delta variant was a dramatic increase in how transmissible it is, which essentially what that means is it takes a much higher immunity level to get it to stop. And so that is what we're experiencing right now is that exact change from an R naught of 3 to an R naught of 8.
And then just a quick follow-up. Did I hear you say earlier that this surge is so big that it probably won't end until we have herd immunity one way or another?
Well, if we are able to stop the surge, it's certainly going to spread it out. And whether or not that turns into maybe another mini wave or something like that, but you know this virus is going to want to get to herd immunity real quick. And so we probably don't have time to do a lot of vaccine. I mean, we need to do as much vaccination as we can, but the key thing is to slow down now so we buy time in order to get our vaccination rates. But we are definitely in that space of finding out who are the last people to get infected in order to reach herd immunity. And so that's and it's a sizable population in Oregon. I would say we have about 1.2 million people who are still susceptible. And if they all got infected at once, which is kind of what we're looking at right now, we do not have room for the share that need the hospital. And so that's one of the critical factors here.
Okay.
I would emphasize our goal now is to flatten that curve. As Peter's saying, his model is projected on our current state, which is that we have no bumpers in place to slow the spread of this virus right now. So his model is predicted based upon our current vaccination rate across the state, the number of people who've been previously infected, and the fact that there are no policy measures in place to otherwise slow it down, such as masking, distancing, stay-at-home orders, things that have been done in the past. So we are on a trajectory that will overwhelm our hospital system and get a lot of people sick. Even if they're not hospitalized, they'll become infected with COVID. So if we can put measures in place, it buys us some time to flatten that curve, which assists with our hospital capacity and gets us a longer timeline to vaccination. Because as Dr. Nolt mentioned, right now, we want everybody to get vaccinated, but being vaccinated now is a little too late for actively managing this surge because of the interval between vaccines and the 2-week time frame after the vaccination. So even so, we need to get people vaccinated to get to the total concept of herd immunity, which is a combination of the percentage of people vaccinated plus the percentage of people who've been previously infected. Peter, does that sound about right?
Yeah, that's exactly right. And, one thing I do want to point out with the chart, if you're looking at it still or thinking about it, is it goes up very high. And you might think, what are the odds that our hospital census could get really that high? We already had a big peak during the winter fall surge. And I have to tell you, if you look at all the other states, they've reached levels 3-4 times higher than we've ever seen here. It is definitely possible, and we are definitely on that path. And I wish we weren't, but that's the unfortunate situation is there's enough unvaccinated and unsusceptible people out there that is all that the virus needs.
Thank you, Dr. Graven. And if there are no other remarks our speakers would like to make, we're going to end the media availability. Any last remarks? Thank you.